The health sector has been described as the most corrupt of all federal government's ministries, departments and agencies, hence the unfortunate situation of the federal government-owned hospitals in the country. Leadership of the Joint Health Sector Union, Johesu, dropped the hint while briefing members of the House of Representatives press corps on a bill seeking to amend the administrative heads of hospitals to allow other health workers, apart from physicians who do not have administrative experience, take charge.
ICPC, and I submit with a sense of responsibility, recently carried out an audit of all the MDAs in the different sectors of this economy, and the damning reports that we got was that the MDAs in the health sector, especially, and I believe this is really dominated by the federal health institutions, are the most corrupt in this country. You are aware that the MD of FMC Owo has today been arraigned by ICPC for misappropriating COVID-19 funds. You need to go and check out what has happened to our drug revolving funds in this country. In most of the teaching hospitals, they are decapitated because these CMDs have misappropriated those funds.
Earlier, at a public hearing organized by the House Committee on Public Health Institutions, several health workers' unions are advocating for the amendment of the Board of University Teaching Hospital for effective service delivery in the healthcare sector of the country.
Then the first among the issues to be attended to is who heads the hospital. If you are heading the hospital, what should your nomenclature, what should we call your name? Hitherto, before now, the name given to the head of the hospital is Chief Medical Director. And we have seen that from that nomenclature, we have a very wrong footing, because when you call yourself Chief Medical Director, you are not there to manage medical issues alone. You are supposed to be a manager of resources and human beings, and not to go deal with your practice or special area of, your special area of calling in medicine. So what the bill is driving at is make that position open. Change the name from Chief Medical Director to Chief Executive Officers as obtainable in other climes of the world, international best practices.
Federal Minister of Health is against this bill and wishes the honorable members to note that, one, the University Teaching Hospital is a well-organized system under the Federal Minister of Health with a mandate on manpower training, service delivery, and research. Two, the University Teaching hospitals have a well-thought-out organizational structure, which has led to improved healthcare service delivery in the country, and were designed primarily to train medical students and other health professionals. The Chief Medical Director of a university teaching hospital should be someone whose scope and depth of training are best suited for the professional and administrative headship of hospitals.
Meanwhile, a federal lawmaker from Osun State, Honorable Bamidele Salam, who sponsored the bill, harped on the need for specialization in hospital administration and stated that it is one of the most advanced leadership careers in healthcare, citing examples with the USA and other countries where medical training on administration have been successful.
Indicated in the title of the bill, the purpose of the bill is to bring the management of our teaching hospitals in line with best global practices, because as we all know, leadership determines almost everything that happens in any establishment. And it is my view very strongly that we should have a health institution that allows for the best of hands in terms of management capacity to head such institutions, as it obtains in several other parts of the world. So, Mr. Chairman, the bill seeks, among others, to provide that the nomenclature of the head of the hospital should be the Chief Executive Officer, who shall be a healthcare professional with not less than 12 years certification in hospital management board and administration and health policy, and must also hold a postgraduate professional qualification obtain not less than 5 years, and of course shall be a full-time on appointment with the teaching hospital.
The bill, if passed and assented to by the President, according to stakeholders, will improve healthcare service delivery in the country. Anita Patrick, Core TV News, Abuja.